How does the Wiggers diagram relate to heart mechanics? Imagine watching a detailed map of how your heart beats, not just in words but visually, showing every squeeze and relax, every pressure change, and every electrical spark. That's what the Wiggers diagram does. It's like a heartbeat blueprint that connects what your heart is doing physically with what's happening inside it electrically and fluid-wise. The diagram lines up the timing of the heart's phases with pressure, volume, electrical signals, and sounds, giving us a full picture of heart mechanics. Let's start with the basics. The heart goes through two main parts in each beat: systole when it contracts and diastole when it relaxes. The Wiggers diagram plots these phases along a timeline. It shows how pressure in the atria and ventricles rises and falls during each phase. When the atria contract, they push blood into the ventricles, causing a small rise in pressure and volume. This is called atrial systole. Then the ventricles contract, and their pressure jumps sharply. This is ventricular systole. As the ventricles contract, the pressure in the ventricle surpasses the pressure in the aorta, causing the aortic valve to open. Blood then rushes out into the aorta, decreasing ventricular volume. The pressure in the aorta rises as blood is ejected and then falls as the ventricles relax. During this relaxation, the pressure in the ventricles drops below the aortic pressure, causing the aortic valve to close. This closure produces the second heart sound. The diagram also shows the electrical signals that trigger these events. The P wave on the electrocardiogram marks atrial depolarization, leading to atrial contraction. The QRS complex signals ventricular depolarization, which causes ventricular contraction. The T wave shows ventricular repolarization, leading to relaxation. The Wiggers diagram also includes heart sounds, which are caused by valve closures. The first sound occurs when the atrioventricular valves close at the start of ventricular systole. The second sound happens when the semilunar valves close at the start of ventricular diastole. These sounds line up with the pressure changes and valve movements on the diagram. This visual tool helps us understand how the heart's mechanical actions are coordinated with electrical signals and blood flow. For example, during isovolumetric contraction, the ventricles contract with all valves closed, causing pressure to rise without volume change. When the pressure exceeds that in the aorta, the aortic valve opens and blood is ejected, decreasing ventricular volume. During relaxation, the ventricles relax with all valves closed again, pressure drops, and the heart fills passively during diastole. In the context of the systems of maintenance and exchange, the Wiggers diagram shows how pressure and volume changes are essential for blood to flow efficiently through the heart and into the body. It helps us see how the heart acts as a pump, maintaining blood circulation by creating the necessary pressure gradients. For students and doctors, it's a clear way to visualize normal heart function and spot issues like valve problems or poor contractility by comparing actual data to the diagram. In essence, the Wiggers diagram connects the dots between the anatomy of the heart, its electrical signals, and the physical process of pumping blood. It's a vital tool for understanding how the heart keeps the blood moving smoothly, ensuring every part of your body gets the oxygen and nutrients it needs.